Herschel is not excited about having all these people in his home. He's lived there forever, and many times the caregivers coming into the home are women, and all these women are coming into his home, telling him, helping him figure out what he's going to have for dinner and reminding him to take his medication. So maybe he's not getting along very well with the idea of having visitors in his home, let's say. And maybe he's starting the grieving process. Maybe he's realizing that with all of this buzz and care in the family and in the home about the wife, that maybe it's starting to sink in for him that she might die. And so any of the providers who have spoken thus far could call me in and say, okay, he's starting to grieve, and maybe he's struggling with these folks being in the home. Is there anything you can do to help? So the way that I wanted to explain my services a little bit is to have a phone call with the daughter, because that's usually what happens, is that someone's child calls me and says, somebody gave me your name, please tell me what you do. So we're going to have a phone call that's pretty typical of the calls that I get. So hit it.
Laura, hey, this is Mary. Melissa with Hospice suggested that I call you because my dad is really resistant to having caregivers come into the home. But I'm in California, and I really need somebody to help take care of my mom. My dad, I don't think, is really in a position to do that. And I don't even know how you're going to help them, but the hospice lady said I should call you. Is this the right number?
Yeah, and that's usually how it goes. Yes, it is. So my company provides clinical social workers to come in and provide clinical social work services in the home. We're all LCSWs, licensed clinical social workers, which means that our services can be paid for by Medicare. And I'll say more about that in a minute, because that's usually where all the questions come. But what we do is that we could come in and be helpful to your dad in accepting help in his home, but also around some of the grief issues that he may be experiencing around the loss of his wife, and maybe his own fears about death at this point, because anytime anyone close to you dies, you certainly think of your own mortality.
So when you said licensed clinical social worker, what does that mean?
Okay, so clinical social work services, as Medicare defines what we do, that could include coordination of care with some of the other medical providers. So likely we would be talking to Melissa's team. Likely we would be talking to the home care team. We probably could speak with the elder care attorney, depending on what services are still needed for the patient. We would provide counseling or psychotherapy. We're often in the position to really assess what's going on clinically with the patient, sometimes even to provide a diagnosis of maybe we have gotten to the place of dementia, or maybe not. Maybe this is something else that's causing confusion or forgetfulness. So we're often involved in helping the doctor or the other care providers kind of tease that out. And then, of course, suggesting solutions as well. But Medicare allows us to intervene and treat, as well as evaluate our treatment outcomes.